Hello and welcome to Wellbeing. I'm Jack Hodgins. Today I'll be discussing the organisation StepUp for Dementia Research. StepUp for Dementia Research's mission is to connect individuals both and without dementia to conduct studies in dementia prevention, diagnosis, treatment, care and cure. We are joined by Director of StepUp for Dementia Research, Professor Yun-Hee Jeon from Sydney University. Professor Jeon is recognised as a leader in research in person-centred care, reablement, measuring quality and outcome measures in dementia and aged care workforce leadership. Her findings across these fields have been used to inform policy development in aged and dementia care. Hello Yun-Hee, and welcome to the program.
Good morning.
What is StepUp for Dementia Research and what is it trying to achieve?
StepUp for Dementia Research is an online poster and telephone service that connects people interested in volunteering for dementia research with researchers recruiting for their studies. It's similar to an online dating service in the way that it matches people with or without dementia with research studies based on their characteristics such as age, location, and diagnosis. We have developed a service 2019. We launched it 2019 June, and to really support the public to be able to have their voice in advancing dementia care, diagnosis, treatment, and finding cure. This is where we really want to ensure the public understands their role in advancing science, but also give them voice. Whatever area that they're interested in, they have opportunity to contribute. Also, we would like to ensure researchers have sufficient infrastructure to progress their studies in a timely manner. Recruitment can be very time-consuming and very costly, and it is important that we have support service that enables researchers to complete their studies in an efficient manner.
Why is it important we now have StepUp for Dementia Research? What was the situation like before?
As a researcher, I'm a researcher and academic. When we recruit research participants, we normally, very much depending on what your research question is, but we often reach out to healthcare professionals or the public through community newsletters or sometimes media or social media. We rely on public having an opportunity to actually hear about it or find out about study by someone else. What that means is that we don't have a systematic way to reach out to the public, and therefore it could actually take quite longer than we researchers anticipate when we conduct research. When we looked at most common studies like clinical trials, for example, they cost a lot of money to conduct, but they rely on participation of the public. Trials often get delayed because they cannot recruit their participants in a timely manner, and sometimes they have to close their trial if they can't get enough number of participants for their trial. We've known about this problem for a long time, and this is not just a problem that we experience in Australia. It's a problem that is experienced globally. There have been a number of efforts or initiatives in other countries. But in Australia, StepUp is the first program that enables or allows for this, matching process that enables researchers to reach out to the public in an efficient way.
And overall, how much funding and overall attention in Australia is given to dementia research?
Well, I think attention is growing, but very slowly compared to other research studies such as cancer or cardiovascular disease.
Why do you think it's not as a high priority?
That's a very good question. I guess it ties into a notion that dementia is not curable. There is no straight answer to treat dementia. There are many different ways of supporting when someone is diagnosed with dementia, but there is no cure. So one of the reasons, relates to the fact that there is no cure, and therefore it is not easy for people to get into a study that if they feel that there is no hope. When in fact there are a lot of things that we can do, and research has advanced the field, the science, but also practice and our service delivery great deal. So there is this, notion of hopelessness, those things that play a role. People want to do something when they know there is a straight answer. Dementia, the term itself is highly stigmatized. We know that stigma is the single biggest barrier limiting people around the world from dramatically improving how they live with dementia. And that was what we were told when one of the international organizations, Alzheimer's Disease Internationals, talk about dementia, because stigma is hampering people's behaviors when it comes to accessing services, when it comes to thinking about what they want to do, what they think needs to be done. So, I think, dementia is one of those health conditions that suffers a lot because of lack of understanding of the public about what can be done. And this, impacts on motivating people to do something about the cause to enhance, advanced science, enhance service, and so on.
Just as a side note, how prevalent is dementia in society?
Globally, the latest WHO report told us that it's over 55 million people around the world. And in Australia, we know that the numbers are estimated, figures. It's not precise numbers, but it's around between 386,000 and 472,000 people are currently living with dementia. Our society is aging, and the number of people with dementia continues to grow. In the next 30 years, the numbers can go close to 2 million. It is prevalent, and especially if we are looking at people over the age of 65, so that's kind of former category of, being old in Australia. 1 in 12 older people have a chance of having dementia, right? It is prevalent for the older population.
A little bit about your specific role at StepUp for Dementia Research. So you're the director. What does that role involve?
StepUp for Dementia Research was initially funded by the Commonwealth Government Department of Health, and we built the service for the first time in Australia, and this was made possible as we had a very strong collaboration with the UK Joint Dementia Research team. The Joint Dementia Research StepUp for Dementia Research is modeled after Joint Dementia Research, and Joint Dementia Research that was introduced in early to mid 2015, and they have been supported by the UK Government Department of Health. So what we have done is, with the initial funding from the Australian government, we developed StepUp for Dementia Research. Even though we are modeled after Joint Dementia Research, it was really important that we make it suitable for the Australian context. Any researchers who have studies focusing on dementia, they can use our service for free. So we provided this training of the service for StepUp for Dementia Research database use. So researchers get trained through our service. We also have help desk so that people interested in registering on StepUp, they can phone us and we can help them register. And also, so that means we provide the help desk support. My role is as a director, to make sure that our service is providing the support that the public and researchers need to contribute to advancing science.
You're listening to Wellbeing. My guest today is Director of StepUp for Dementia Research, Professor Yun-Hee Jeon from Sydney University. And what exactly is dementia? What does it do exactly?
So dementia is an umbrella term, and I think we hear that quite often what it actually means. And it affects individuals' cognition, and also that affects that person's behaviors and daily living. There are so many different types of dementia, and most common form of dementia is Alzheimer's disease. And so that's why people often hear about Alzheimer's disease. But there are other forms of dementia, such as vascular dementia, frontotemporal dementia. There are also dementias that affect, a mixed form of dementia. So there are, over 100 different types of dementia. Most of them are incurable, age-related health conditions. So as you get older, the risk increases substantially. If you are over 80, if you go up over 90, every age increases, there is a higher risk. By the time you have reached over 90, the chances of, having dementia would be 1 in 3, for example. The dementia affects the person's brain, but it affects the person's life and others. So what we are trying to do is make sure that when they have dementia, that there are appropriate support and services are accessible.
And I think we touched upon some really important things then, and especially in defining a bit about what it is. When someone develops dementia and as it progresses, what are some of the strains that it has on daily life?
Dementia is often associated with memory loss. Of course, memory loss is, one of the key features. It affects the person's day-to-day decision-making. It also affects their communication. They may not have capacity to go out shopping. They may be able to do all these things. So depending on their severity, the person can have different level of limitations. Even doing their daily house chores, cooking and making planning, these things could be affected. These kind of limitations that people experience, and depending on the type of dementia, they may have different, limitations in their daily living. And other times, people may struggle to really distinguish reality and hallucination. Some people progress into advanced dementia in a very gradual manner. This is another challenge that we often face when we talk about dementia, because it's not just one thing. As I said, there are so many different types of dementia that we're still learning about all these different types of dementia. And therefore, we need a lot more work to understand. And that's a pathway to finding a cure. That is why we want to do more research and we want more public to be involved.
And moving forward into the future, say 60 years in the future, what could, say, like the younger generation, should they be not worried, of course, right now, but could they expect that they may experience very similar things when they get elderly, or will it be a better situation? Will there be better technology, or what will be the story then?
I guess, 60 years, I guess it depends. If we can find a cure for dementia, the story may change substantially. Our focus should be about the fact that we have better understanding about what it means to have dementia, but also we have a better way of reducing risk of developing dementia. We already know that there are 12 risk factors to dementia. So, we can actually reduce the risk of developing dementia, and therefore that we reduce the prevalence. As I said, dementia is age-related. Therefore, the numbers will grow as the population ages. But at the same time, there are a lot of other things that we can do to reduce the risk. That's where we should focus on. In 60 years' time, my wish is that dementia stigma is removed from dementia. That's my hope, and I think that is possible. A better trained workforce to provide care for people living with dementia and their carers. What I would also like to see happen is that people, and that's associated with reducing or removing stigma. I would like to see that more people interested in contributing to research by participating in research, but also being involved in research. So when we say being involved or involvement in research, we are talking about that there is more to participation than being, a research subject. So when we talk about research participation, people become the subject of the research, which is really important. But when they get to be involved in research, they can actually also have, opportunity to work with researchers as collaborators. So we work with a number of, of people who are living with dementia, their carers, or of public in general that who are interested in dementia research, working with researchers, because especially if we want to, look at better intervention, psychosocial intervention, or, a new service or better service to support people living with dementia, we really want to hear the perspectives of people with a lived experience, so that whatever research evidence we generate, the evidence is actually meaningful. What that means is that people can actually are more likely to accept the evidence when we, publish the work. It's a very simplistic way of describing it, but what I'm trying to say is that it is really important that researchers like myself, that we work with people who have lived experience, so that when we generate evidence that they have made a contribution to advancing science, and also having meaningful outcomes. So they can be part of advisory group. They can also give us support in terms of, how we should look at the data, or how we should actually disseminate findings in a way that is going to be more accessible to people like themselves. It's about breaking the barrier between researchers and the public. They become more of collaborators. Fulfilling experiences for me as a researcher, it gives us opportunity to really think things through. Otherwise, a lot of what we do become based on what we read about, rather than, having that journey with the person living with dementia and or with their carers. That's why we really want to let people know the value of public involvement in research. So, and I think in doing that, when we get to have more public involved in research, not just as a research participant, then we have a better way of actually, reducing stigma attached to dementia.
You're listening to Wellbeing, where we are discussing the organisation StepUp for Dementia Research. My guest today is Director of StepUp for Dementia Research, Professor Yun-Hee Jeon from Sydney University. And I think that gave some great insight, because it seems like it should become more of a journey, especially with the patient that does have dementia, and it seems that, because it can be, I would imagine, be really frustrating having dementia. So I would imagine that it would be better to be on a journey with that person to and work with them, because I can imagine that it would be hard to kind of comprehend at times that person with dementia, what's kind of going on and how to kind of work with that. So it sounds like it should be more of a journey more than anything else.
Yeah, that's right. But we also have to appreciate that participating in research and being involved in research requires quite a lot of effort. What we are trying to do is that, people really understand what it means to participate in research, but also what it means to be involved in research. And our StepUp for Dementia Research has, about 14 members of the public involvement panel. And they are people living with dementia and their care partners, or carers who used to, be the main carer for their loved ones. And, they are highly committed to supporting researchers, but also advancing, the field of dementia care, and the treatment, diagnosis, and prevention, and so on. It requires their commitment, because we meet every, 2 months or every 3 months, and they become an active advocate for dementia research. So that's the kind of involvement that we ask our public involvement, panel members. So what we are trying to do is to make sure that researchers understand what it means to involve the public in their research, but also the public understands what it means to be involved in research, because it takes up their time, it takes up their energy to be part of the journey together. So you're absolutely right. It is a journey in many ways, but it's a journey that actually requires good understanding of each other's goals and the aims that they want to achieve. It needs a lot more work to be done, but we are definitely in the right direction.
And it does seem we've touched upon the stigma a bit, and so it leads me to this question, because it seems as though the situation may not be as dire as what the media makes it out to be. How can someone thrive and have a really good quality of life even though they have dementia?
Well, I think that, this is where we need to have a broader public debate around what it means to have dementia and to live with dementia. It's not a death sentence. Of course, it is going to affect the person's everyday life and affect their relationships with other people. But with the right support and the timely support, there are ways to actually manage better. So when we, put out information, we make sure that, people understand there is something that can be done to support them, to help them live, well or manage dementia, and their, families and friends can understand better. I think we are talking more about reframing dementia nowadays, so that people understand that they don't just go home and then worry about their dementia without any support. So what we are trying to do is that we need to inform our health and social care providers about the importance of post-diagnostic support that hasn't been well managed. A lot of people talk about when they have diagnosis, they don't have sufficient information to go on. And so I think, there is a lot more we can do in terms of health and social care provider support, but also at the time of the diagnosis, how specialists, provide that information. There are many different points that we can actually address this issue of living well with dementia or having support. They can actually enjoy their life for many years to come. So I think, as I said, that there is a growing number of programs and, support services now trying to address this issue of, ensuring that people get timely support when they have, diagnosis of dementia.
And just for the listeners who may be wanting to get involved, what's the best way for them to do that?
If people want to know more about post-diagnostic support, especially, in the first 12 months or 24 months of diagnosis, they can come to forwardwithdementia.org.au. So that's a new program. But when people really interested in participating in research, they can come to our website, StepUp for Dementia Research, one word, StepUp for Dementia Research.org.au, and this is where they can find the information. If they want to contact us by phone, we have a help desk phone number, so it's 1-800-7837-123. So 1-800-7837-123 is our StepUp for Dementia Research help desk number. But I also have to remind the audience that we are not a clinical service. We occasionally get a phone call, from people who are seeking information about clinical service or advice. We are a service designed to provide the public opportunity to participate in research. And when they sign up with the StepUp for Dementia Research, they get to learn about potential research participation opportunities. That's our main service.
What would be the take-home from this interview you'd want people to remember the most?
Dementia is a heavily stigmatized and heavily misunderstood condition. And what I would like people to understand is that there is a lot more that we can do when it comes to dementia care and support. And also it is really crucial that we have more people in our community coming forward to participate in research, because research underpins a whole range of things, service, care, policy development, as well as finding cure. And without people participating in research, we can't do our job. And we would really love to have more people joining StepUp for Dementia Research.
Well, thank you for sharing a bit about StepUp for Dementia Research today, Yun-Hee. We appreciate you taking the time.
Thank you for the opportunity.
My guest today was Director of StepUp for Dementia Research, Professor Yun-Hee Jeon from Sydney University. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.